Hello, everyone. We're back again with another conversation today. Really excited about today. Have a really good friend that is going to join us, and I'm really excited for him to share a little bit about what he does and his story. And again, as all of you know, I'm Miriam Campos, and if you guys have any questions or any ideas about future opportunities, please feel free to let me know. And again, this group is to help you network and to connect with resources that are out in the community, but also to connect you with individuals who are doing really amazing things. And so I am going to bring on our guest, good friend Juan Carlos Claros, which is Dr. Juan Carlos. ¿Cómo estás?
Hola Miriam, ¿qué tal?
¿Qué tal? ¿Cómo te va tu día?
Bien, bien.
Well, so we're excited to have you. I'm really proud of all the work that you're doing and have seen some really neat things that you are doing in medicine. So just want to welcome you and really happy for you to just tell us a little bit about yourself and, you know, where you come from and share a little bit about your background. So
Yeah.
tell us a little bit about yourself.
No, well, thank you for having me. I know we've been kind of friends, acquaintances for what, like 3, 4 years now. And I didn't know you had this until you reached out. So thank you for including me into this group. I don't have Facebook, so I don't know what's going on the Facebook Live. But if I ever get Facebook again, I'm definitely going to join the group. A little bit about me. I'm originally from El Salvador. I was born and raised there. Was born in the middle of the Civil War in El Salvador, for those of you that are from El Salvador in the group or are from Central America. El Salvador had a civil war from 1980 to 1992, and I was born in 85, so right dead center in it. And at age 16, my mom and my brother, we moved to the United States. And I've been bouncing around the country for a little bit. I finished high school in like a suburb of Atlanta, Georgia. I went to college in New Jersey, medical school in Tennessee. I did my general surgery residency here at the University of Oklahoma. And then I went to Texas to get a breast surgical oncology fellowship. So I've been around the country for a bit now, but I'm in Oklahoma and, left for a year, but I'm hoping to make Oklahoma home now. Oklahoma.
Yeah, we're happy that you came to Oklahoma. I know there's a lot of friends that you mentioned, a lot of Salvadoreños that are watching that are here. And so I'm really excited to hear a little bit about what you're doing here in Oklahoma now. So you are now a breast cancer surgeon, right?
Yeah.
So tell me a little bit about your role now.
So I'm one of the breast surgical oncologists at Stevenson Cancer Center, which is kind of like the cancer center for OU Medicine and OU Medical Center. So essentially, my role as the surgical oncologist is we're part of a team between medical oncologists, radiation oncologists, breast radiologists, and just different subspecialties that as a team we create kind of personalized treatments for all the patients that we see. So my role will essentially, is provide my input from a surgical standpoint, and I perform the surgeries, whether they are breast conservation surgeries with lumpectomies, mastectomies, oncoplastic surgeries. And I also work together with the plastic surgeons, women that want to have immediate breast reconstructions for the ones that decide to undergo bilateral mastectomies. So it's a great field. I love what I do, and I wouldn't change it for anything.
Well, we're excited that you're in that field because I'm sure you have a lot of patients that, sometimes get to connect with you. And have you had very many patients that speak to you in Spanish?
Yes, I've had a lot of, I believe, unless that has changed, I'm the only Spanish speaking breast surgeon in the state. I know different clinics may have Spanish speaking staff, whether they're medical assistants or nursing staff. But I'm really proud of, just to be able to connect to the patients directly without requiring the need of an interpreter. There's plenty of studies that show that if you speak the language of the patient, they're going to feel more comfortable. They're going to understand, especially from a surgical standpoint, understand the risk, benefits, potential complications, etc. So I do have not a ton. I wish I was treating more Spanish-speaking patients, but I do have quite a few very memorable Spanish-speaking patients from Oklahoma City, and some that have come up all the way from Lawton and other parts of the state.
So, as we're talking about what you do, what inspired you to get into this field?
So I guess it kind of goes all the way back to this is kind of a joke and kind of explains why I'm going to say this. My mom, I don't recall this at all, but my mom always says that from a very young age, I said that I was going to be either a doctor or a clown, and I'm pretty sure she's happy I picked the doctor. And I don't know if it had anything to do with growing up in the middle of the war, seeing so much death and just the sadness and injuries from war, not personally or directly to my family, but in a societal standpoint in El Salvador. So I'm not sure if it was that maybe planted the seed early on to be like, I'm going to go into medicine. And as I went through med school, I was like, well, I want to be a surgeon. I knew through medical school that I wanted to be a surgeon. And as I was going through the 5 years of surgical training, it's when I decided, well, like I really enjoy my breast surgical rotations. We actually have a couple of friends in common that have been diagnosed with breast cancer as I was going through my breast surgical rotations in residency. And that made it hit a little bit closer to home. And after that, after seeing the lack of, especially Spanish-speaking breast cancer physicians, I was like, well, this is an area that I can really make an impact, not only here, but really anywhere in the country.
Absolutely. And I'm sure there's such a need in the medical field just in general, but I love that you're taking on, I mean, the surgery part is always really scary for patients. So,
Yeah.
I mean, I can just imagine all the lives you're impacting. But you're also an assistant professor of surgery. So I'd love
Correct.
for you to talk to us a little bit about that.
So at Stevenson Cancer Center, which is the cancer center for OU, that's where I do most of my clinical work. But I also have a educational component to my job, which is essentially I work with the medical students and I work with the surgical residents, just the same way that I was taught as a resident through the 5 years of training. Now I'm in charge of developing curriculum for the residents and essentially just bringing them to the operating room and teaching them just the way that I was taught how to do the breast surgeries that I now perform. OU as an educational institution, it's kind of, I wouldn't say unwritten rule or unwritten expectation that we're a teaching institution. So we are going to have residents. We are going to have medical students in our surgeries. And it is my job as an assistant professor to, gauge how as residents advance from first year to fifth year, how competent they are, and not only to train them, but also to letting them operate as well, but under direct supervision by me. So no procedure ever goes unsupervised. No procedure am I not present or personally doing the procedure myself.
Well, I'm sure we all appreciate that.
Yeah.
You were there supervising.
Yeah, well, that's and that's the thing though. Like especially when it comes to cancer, it's such a delicate surgery that for the most part, more residents are probably wanting to do more than I let them do because of that. I'm sure a lot of times they want to do more part of what the procedure entails. But when it comes to cancer, I think the majority of surgeons are like, this is my surgery. Like we're going to take care of stuff. But if I don't teach, if we don't teach the next generation, how do we, there's not going to be another generation of surgeons. So there is a balance in, learning to, just let the residents operate as well. But that never goes unsupervised, and for as minor as the surgical procedure is. And I really enjoy that. Like I said, I enjoy teaching the residents and the student both inside and outside the operating room.
Well, we're happy that you're there. I'm sure that, as a student and a resident, that, people look up to you and they're looking at your leadership. So that is just, again, excellent work that you get to do day to day. And speaking of these, very difficult topics and things, for you get to deal with this daily, but for some people it's very new. But what can we do to educate our community a little bit more about breast cancer, specifically in our Latino community? There's a lot to be done, but
Yeah.
what do you think needs to be done?
Well, with regards to breast cancer, I think the biggest message we can send, or I can send, is just get your mammograms, right? Uh, Outcomes with regards to breast cancer are directly related to how early we identify it, how early we catch it. So the survival and the prognosis of somebody that it's diagnosed at a stage 0 breast cancer, which is non-invasive breast cancer, versus somebody who has a stage 3 or cancer already in the lymph nodes or potentially going to other parts of the body. Uh, the prognosis is better the earlier you find it, and that can only be achieved if women are undergoing their mammograms that are, every year starting at age 40. That's usually what we recommend. Okay. So I think that's the biggest message that we can send. If we find that early, not only translate into, better survivals, but also less invasive procedures, meaning less chance that you're going to need chemotherapy, less chance that you're going to need radiation, less chance that you may even need a mastectomy. The majority of women, and this is part of my job, is try to perform more breast conservations rather than mastectomies. My job is not just to remove all breasts at the moment there's cancer. My job is also to offer to the patients that have the right indications to do breast conservation. But what I mean by that is, if the tumor is small, if it's found at an earlier stage, that I can just go in, remove just a small area of the breast where the tumor is, leave the cosmesis of the breast almost intact, and the patient, can keep her breast, which we know that from a psychological standpoint is much better for the patient. In a way, I feel that some women come in thinking, maybe they have like a tiny 1 centimeter tumor, and they're like, I just want both breasts gone. I just take off both breasts because I don't want chemotherapy. And it is my job as a physician and as a surgeon to tell them, no, like if you're gonna need chemo, you're gonna need chemo. It's gonna be based on this stage. It's not based on the type of surgery I do. Like even if I do just a lumpectomy, if I take both breasts, you're still gonna need chemo. So when we educate patients, it's really when they understand it and they're like, oh well, if I'm going to need chemo either way, and I'm not saying that all patients need chemo, I don't want to send the wrong message either, but what I'm saying is, if the type of surgery we do doesn't necessarily change the overall treatments that we're going to provide. So once again, early mammograms, they save lives. Go get them done, because that means less surgeries, less chemos, less radiation, less of everything, and more survival.
Well, before I say it, I want to show you have a #1 fan here.
Yeah, I can see her now. I didn't know they popped over here too, because I don't have Facebook, but they're popping up on my screen.
Yeah, so I knew you were going to have a few friends and fans coming up. But speaking of, you just mentioned a few different things. So, preventative, early diagnosing. Is that, is that something that our community is doing well, or
Especially among the Latino community, not as well. And you can, and we can spend an entire hour talking about the, social and different barriers, social and economic barriers to getting access to medicine. And like I said, that's all, I think, a whole different discussion.
Yeah.
But I think part of it are, there's two main things. One is education, or just women not knowing that they needed to go get their mammograms until they feel a lump. So one is education. So, groups like this, that even though it says young professionals, every young professional also has a mother, right? So just telling our mothers, hey, go get your mammogram done. And second, like I said, is just limited access to mammograms, whether it's from a geographical location, if they live in rural Oklahoma, or from an economic standpoint, and lack of health insurance or healthcare in general. There's a lot of programs out there, particularly among Project Woman. I think there's one, and there's some other ones. I'm lacking on the actual name, the Oklahoma Latino Foundation or something like that. That they have a lot of funds that actually pay for a lot of mammograms for Latino women. So there are ways and support and financial support to get your mammogram done. But like I said, I believe that those are the two main barriers. One, education and lack of knowledge that they needed to get it done. Two, the socioeconomic barriers. And actually, a third one, now that I think about it, is fear. A lot of women just don't want to know. They don't want, they don't want to, the fear of they rather not know that it's there rather than deal with the diagnosis. So I think, especially within the Latino culture, there may be a significant factor of fear.
That's so true.
Somebody mentioned LCDA. Yes,
yeah,
that one.
Yeah, LCDA
Thank
is
you.
another one that they do have free mammograms, and but you did mention something that I think is super important, is that I feel like a lot of moms and grandmas and sisters and tias and everybody, I feel like they don't want to be a burden, and they know
Correct.
that if they go to the doctor, and I hear that a lot, it's like, no, now I'm gonna have to have medicine, now I'm gonna have to have go to the doctor and bother someone to take me and all these extra things. But I think that's a great message to send to everyone that's watching, to please make sure that no matter what it is, that you don't deny the fact that you need to get checked. You need
Correct.
to make sure you look into that. And now you can get a mammogram before 40 as well, right? If you have any different
With
symptoms or other
with the right indications, yes. So we usually, most studies have shown that 40 is kind of like the magic number, and obviously there's no magic at it. It's just cost to, if every woman started getting mammograms at age 30, there's just a lot of mammograms and it wouldn't be a lot of diagnosis. So, when it comes to medicine, we also have to look at, how many mammograms it takes to diagnose one cancer. So the different societies have different guidelines. So actually, if you look at the American Cancer Society, they will say start at age, I believe, like 45. The United States Preventive Task Force, they say 50. The American College of Radiology, which means, the radiologists are reading mammograms, and the American Society of Breast Surgeons, we're saying age 40. So can a woman get a mammogram at an earlier age? Yes. Now, if a woman has a lump, if a woman has, any nipple discharge, any skin changes, nipple inversion, things like that, that is new, particularly, like, those are indications to go get some breast imaging. It may be an ultrasound at the beginning, not necessarily straight to a mammogram, because women, especially younger than 30, like, their breast is too dense. So a mammogram is like trying to see underwater. Like, you won't be able to see anything. So we may actually start with ultrasounds or MRIs. And also, I should say, women that have a significant family history of breast cancer or ovarian cancer. Now we have genetic testing that can allow us to identify patients that should start screening at age 25. Okay, so in selected patients, it can be as early as 25.
And you said if they have a history of breast cancer and ovarian cancer
In their families,
in the families.
not
Okay.
not the patient themselves. And also, for example, if somebody has their mother or first degree relative had a history of breast cancer at age, for example, 43 because she was getting mammograms yearly starting at age 40, and she was found at 43. Well, her daughters or her sisters or first degree relatives should start 10 years younger. So those women are going to start at age 33.
So all you ladies listening, start early. Make sure you look into your family history and take
Correct.
some
And
notes.
that's another thing. And that's another thing that I should say, especially with Latinos, we have such big families. It's important to ask. And, a lot of times you found out that, la tía se murió, but you never found out what she died of, and I think that's important. Like, like I said, it may just be a cultural thing that, like you mentioned, they don't want to be a burden. They don't want to, they feel like it's such a stigma behind cancer. But it's important for them to ask, okay, the grandma had breast cancer, the grandma had ovarian cancer, or so it's important for them to ask those questions.
Yeah, I feel like I've had several stories where, like, well, ¿de qué se murió? Don't know why.
Se murió la tía, and everybody's like, oh, okay, lo sentimos, but it's like you never found out.
And they just say, they were sick, but they don't know what exactly that it was. So definitely. And I think we're a little bit frozen there, but we'll get back. I do have a comment from Brenda. She's saying, thank you so much for stressing the importance of women getting our breast exams done, especially if there's a history in our family of cancer. Absolutely. And we're getting connected again. And I can't agree more. That's definitely very important for us to continue to check with your family history. And then Francisco is a cultural thing that the fact that our elders think that they would become a financial burden prevents them from being open in their illness. That's absolutely correct. And as many of you know, this is something that, there's different types of cancer, but we definitely want to make sure that we cover this specific area that Juan Carlos is specialized in. And so he's going to get connected back in just a second.
Hey, sorry.
Yes, got it. We got you. And so I was just reading a few different comments about the importance of checking early, and also the family history, making sure we do check into that with our family. It is something that we have to break these barriers of historical, things in our culture. But I definitely think that with more information, people will continue to learn. But I'd love for you to share a little bit about the work that you're doing, speaking of education, at OU, to encourage more, more Latino diversity and inclusion. I know you mentioned a little bit about that. So tell us about that.
As part of I forgot what the actual numbers were, but the Latinos make up a really, really small number of the physicians over here at OU Medicine. And altogether, whether it's African American, Native American, or Latinos, we created a diversity and inclusion task force. And we are developing different programs, both for the community and education and mentoring, to try to get more, not only African Americans, but on my end as well, Latinos. And for one thing is just to show them that it's possible. Especially myself as an immigrant, it was really scary in the beginning, not knowing how am I going to pay for med school. It's so many years of between college and medical school. That's 8 years of graduate, 4 of graduate education, 4 of college, plus 5 years of residency. It's so many years of investment, whether it's through loans, whether it's through scholarships. So one thing is just to show them, for them to see a familiar face and tell them, hey, if I did it, you guys can do it. And second is just mentoring, letting them have access to our emails, have access to our information. So if they have so many questions, if they want to come and shadow us, if they want to come and just really ask us more definitive questions about what's the process to get into medical school, what's the process to get into medicine in general. And I'm not saying that I want all kids to become doctors, but physician's assistant, nurses, medical assistants, dentists, scientists in the medical field, whether it's biomedical medicine or biomedical engineering or whatnot. So it's really just to try to get more Latino students, and well, the task force for all underrepresented minorities, but we do have a significant representation among the Latino community, particularly in South Oklahoma. So we've developed within the diversity and inclusion task force, we have developed different programs. One that is called BENGAP, which is for college and high school students, essentially, to try to mentor them in the process of how to apply to medical school. What's going to look good in an application, whether it is volunteering at a hospital, volunteering at a clinic, what kind of research or what kind of clinical work or science work they need to have taken, what kind of science courses they need to take to college. So that was one of them. The second one is we have another one called Club Scrubs, which we take on a lot of like middle schools and high school students. And we essentially take them through through a day of what like a medical student will, go through. So it's just a little bit of not only support for the community, but also just a little bit of mentoring for them. We also have now our medical students involved in this, and they've been able to also work with actually somebody who's watching here right now with the USDA and try to create working more directly with the Latino community as well, and all communities in general with regards to nutrition. We work with the College of Public Health, and kind of developing like meal plans. What's healthy, what's not healthy. Kind of just showing them that a dinner for four at McDonald's is probably just as expensive as actually cooking the food and eating healthier at home. I feel that Latinos as a whole, we tend to cook more, and eat more at home and a little bit healthier, but we still fry a lot of our food. We still, tend to eat, yeah, we do cook at home, but that doesn't necessarily translate into healthier food habits. And that obviously has translated into higher diabetes, higher heart disease, higher renal disease in our communities. So the task force is not only just for education and mentoring students, but also for educating the community as a whole for like healthier habits as well.
Yeah, and I think when you said that you guys are helping and mentoring these younger generation of medical students, I think it's important, specifically of having someone that walks you through the process,
Yeah.
because if you're spending 8 years of school, and time and effort and investing in yourself, and you take the wrong courses, I just can't imagine how that would feel. And so I definitely feel that that's something super important, and we don't have enough of it, but I love that you guys are focusing on this task force. And I see it, my sister-in-law is going through a nursing program right now.
Good.
And I've learned a lot, and there's so much. And I think that if we can continue to build on these efforts and support what you guys are doing, and educate more people about these opportunities, I think people are just afraid of what they don't know.
Correct.
So
And also just afraid, and that's another thing for like the parents. I think I know that as young professionals we have. I don't have any kids myself, but I know there's probably some people watching here that will watch this later on that have kids. It's important to start telling their kids, okay, what do you want to do when you grow up? Start planting that seed early on, and help, because if you don't start asking your kids from early point, what do you want to do, what do you see yourself doing as an adult, and because that's when, and if they mention anything with regards to medicine, or whether it's photography, whether it's marketing, whatever it may be, just to start leading them into that path and showing them there is a way to get there, which is kind of what the goal of this task force is, just to show kids from elementary and middle school all the way through that there is a path. It's not easy. I'm not going to say it's easy, because it's taken a lot of work, but it's completely doable.
A lot of sleepless nights and
Oh
studying
God.
coffee.
Yes. I was counting the other day. I think it's been what, 4 + 4 + 6, so what, 14 years after high school? It's 14 years after high school.
That's incredible. I mean, I applaud you and your time and your commitment, because um, I feel like time goes by regardless. So
Exactly. Might as well do something good with it.
yeah, and do something that you're going to be able to. You're gonna. I mean, you're not only going to do something for yourself, but you're also investing in people around you, the community, the health of someone, whether they get to live or not, for a long period of time. So you are going beyond, the limits of just your years of college. Go further. So, again, I applaud your work. And one of the questions on here, can you please talk a little bit about the need for more Spanish speaking Latino physicians, especially in our area, in your area?
Well, that was one of the reasons why I wanted to stay in Oklahoma City. I came to Oklahoma City right after medical school in 2012. And even, I mean, the change in Oklahoma City from 2012 to now, it's drastic. I remember I lived right downtown at the level apartment, and that was when Bricktown was still kind of like you wouldn't really walk that much around there, and now it's big and beautiful. And as I was graduating residency and I was going out to fellowship and started looking for jobs, I literally went back and looked at the census for Oklahoma, and I saw the Latino community had grown, I believe, like 150 or 200% in the last 10 years. So and that translates to more, Spanish, probably people that only speak Spanish. And I can guarantee you that the growth of the Spanish speaking physicians hasn't been the same.
Mm-hmm.
So yes, there is a need. There is no easy solution. Recruiting to Oklahoma is a little bit difficult, whether it is for surgeons or primary care providers, etc. Especially when people have lived in other parts of the country. Most people want to go live in New York, Miami, San Francisco, etc. My family, most of my family themselves, they were like, why are you staying in Oklahoma? Like my brother and my mom are in New Jersey. I have a lot of family in California, and everybody's like, why Oklahoma? Like, you don't have any family there. But that was one of the reasons I stayed. I know that this is one place that I can make a difference. And I know there's going to be a continued need for more Spanish-speaking physicians. And I'm not saying just surgeons, but everything, whether it's pediatricians, but all the way through to geriatrics. Like there's going to be a continued need for more Spanish-speaking providers, especially as the Latino community continues to grow.
So, well, we're happy you stayed, because yes, we do need more. I'm super happy that you decided to stay and invest in Oklahoma. Um, we are growing, and we have a lot of work to do, but I definitely think that this is the prime time to be in Oklahoma, and that we
Yeah.
will. I mean, it's just
I
gonna.
try to tell my family just to come visit, but they're like, hey, they come visit. My mom and my brother come visit, but maybe I'll get my cousins and stuff. And I tell them, like, it's beautiful. I'm like, it's much cheaper to live, and why not? Like, it's beautiful here. And the only thing that kind of sucks though is traveling. Like, you always have to like, if I want to get to see my
Yeah.
family in New York, like, I have to like connect to Dallas or somewhere, and that's like, like that sounds like a first world problem issue, right? I mean, I get to see my family, but still, though, it's like I want a direct flight everywhere. Like, you know, especially
Yeah.
El Salvador. Like when I used to live in Atlanta, it was great because I could like have breakfast at my house and then like just take the train to the airport and fly to El Salvador and have lunch at the beach in El Salvador, just because there's a direct flight. You know, so if you live in Houston, Atlanta, Dallas, literally it's like a 3 hour flight. And here it's like, well, I have to go to Dallas, and then from here there is the other connection. And once again, it's completely doable. It's not that big of a deal. But that's the one thing that I do miss from having uh, a bigger airport. But it's growing. They're opening an international terminal, from what I've heard.
Yeah. So we're getting there. We are
Yeah,
getting there. I love to travel myself, so I totally understand. But I think we're gonna get there. We'll
hopefully
slowly but surely. So
sooner than later. Hopefully.
yeah, yeah. But I know you wanted to share a little bit about who Dr. Roberto Salinas is, and I'd love for you to tell us a little bit about what he does.
So Roberto Salinas, he's been a little bit of a mentor for me as well, even since I was in residency. He is part of I think he's one of the deans for the Diversity and Inclusion Task Force. Um, and he's really leading this whole program about, education for increasing, well, education and mentoring for the middle school, high school, and at all levels. And he's really kind of like spearheading this program into trying to increase the numbers not only of medical students but also residents. Actively creating programs where we are bringing residents that are Latino. I know there had a Latino medical student from Texas that she was applying to dermatology. So now they're creating programs where they're bringing the Latino or African American or any underrepresented minority into our campus. They're staying with us for a month as a way rotation, just to try to get them into Oklahoma. Once again, what Brenda mentioned about getting more Spanish physicians. We know, kind of like me, I didn't know anything about Oklahoma. If we get them here, they're more likely to stay if they end up training here. So, like I said, Dr. Salinas and I have, he continues to be. I just ran into him actually yesterday, and we discussed a couple of patients on a hallway in the hospital. But he continues to be a great mentor. He's really the person who's leading this diversity and inclusion program here at the College of Science and Health. And another fun fact is that we both like photography. So he has a very nice professional camera, and I got myself one. So even we were talking that we're going to start like a little medical photography group of doctors that like to take pictures. So we have a
So
lot of things in common, both in the hospital, and mentoring, and even in hobbies. So he's a great person.
well, I am sharing a link that you can get more information from this diversity and inclusion department, and also the task force and some of the work that Dr. Salinas is doing. There's a very inspirational video as well that they have on there that is talking about what they're doing in Oklahoma, and switch, trying to capture more of this younger generation. So, if you're
Yeah,
interested
I
in,
cannot take any credit for anything they do. Like, I'm just one little piece to a much bigger puzzle, and they are doing great things, though.
well, you're doing the work too. So the it's a team effort.
It is a team effort.
So, speaking of these mentorship programs, and I know we have a question about that here in a second, but what is your advice to young individuals looking to pursue a career in the medical field?
Um, Depending on the grade of education or level of education they're in, it'd be a little bit different. Uh, but the one I would give as a whole is focus on your grades. Especially if you're in college or middle school, or excuse me, or high school. Focus on your grades. Focus on your uh, entry exams. For example, to get into medical school, you got to take the MCAT. Focus on extracurricular activities. You don't have to take pre-med. Okay, there's such a college bachelor's degree that is called pre-medicine or pre-med, whether it's here at OU or at other colleges. You don't have to do that. You can just, as long as you take the required science courses, you can apply to medical school. I had classmates in my medical school that took Spanish, that took literature, that took art, that took anything. But my main advice is just work hard. I don't mean be a total nerd and don't do sports. I play varsity tennis when I was in high school. I continue to play sports through college. It's not a matter to be a bookworm and do just that. You have to be a well-rounded applicant. Work hard, be passionate. It's not going to be easy, but there is ways to do it. Okay.
And is there like communities of people that kind of come together and work together through medical school?
Uh, Once you're in medical school, you mean, or before you get into medical school?
I guess I know I've just seen or heard of a few different ones, and I feel like, is it once you get into medical school, or is there anything prior that kind of as a community they help you walk through it?
So there are. So the majority of colleges are going to have what they're called pre-professional societies. So I'm sure at OU, I think at my college it was called Galen Society or something like that. But they're essentially where all the pre-medical college students are in, whether it's pre-medicine, pre-dental students, pre-pharmacy students, and they alone are going to be like your first, especially among students, your first group of support and guidance about what courses to take, when to take the test, what kind of research to get involved in if your college offers some form of basic side research or anything like that. So there are, like, most colleges have those groups already, just the same way that they have like Greek life and fraternities and stuff. They also have these groups. So I think that's one. That's before medical school, right? Uh, that's through college. Once you're in medical school, the majority of medical schools are very supportive. I think the attrition rate, or the number of students that actually drop out of medical school, is actually very small, because once you get in, by the time you get into medical school, they know you're smart, because you took 4 years of college and you did well and you took your MCAT. So they know you're smart. They know you can take tests, and they're accepting you as a student, also an investment on their side. So the majority of medical school, they're not there to fail you. They're there to support you and get you through and make sure you graduate, because the majority of medical schools are also graded in how many students drop out. So if they have a lot of dropouts, medical schools can also go into probations. So it's the majority of medical schools, that you get a lot of support once you get in, both from a financial standpoint, even if it's by loans. I do have a big loan debt from my medical school, but I don't see it as a debt. I see it as an investment. I invested on myself, and now I'm in a blessed position that I make the money to pay back.
Yeah,
So it's really an investment. It's not an expense. But
absolutely.
there are a lot of groups, but they're going to be a little bit different depending on the college you're in. And even at a high school level, I think, at that level, what's important is for you to do good in your science courses, do good in your math, biology, physics, chemistry, and get yourself into a good college. And I'm not saying, you've got to go to Harvard, Princeton, or one of them, because ultimately nobody ever remembers what college. Nobody asked me what college I went to. They asked me where I trained, right? Which is for you. So ultimately, the college you go to, even though it may make it easier to get into better medical schools, it's not a deal breaker. I went to William Patterson University, which you're gonna be like, where is that? Like, nobody has heard of that here in Oklahoma. And so the college you go to doesn't necessarily translate into you getting or not getting into a good medical school or a graduate program.
And the Brenda has a question about internships. If you recommend any for the youth that possibly are interested in a medical field.
There are, for example, we have some volunteers here that work as volunteering at a hospital, first of all. Some work as transport. I know Mercy, I think prior to COVID at least, I think COVID has made things a lot more difficult.
Yeah.
Uh, they have, I believe it's at Mercy Hospital, and here at OU we also have essentially they high school students that take the patient from their X-ray to their labs and things like that because they know kind of like the map of the hospital. So that's one thing that they can get them, into the door halfway into talking to physicians, talking to nurses, talking to medical staff, and it's the first thing to put into their CV. Okay, so I will consider that kind of like an internship at a high school level. Volunteer, can always ask to shadow physicians, whether it's in a clinic base or in a operating room setting. That one's a little bit more difficult because the majority of centers are going to want you to be over age of 18. And if you're in high school, the majority are not going to be over the age of 18. So that's going to be a little bit more difficult. So like I said, at a high school level, it's not as important. Now, at a college level, then yes, you can, I actually have had a number of students shadow me. COVID has thrown a big wrench in it because now they're saying, trying to limit the number of people coming in. But through the diversity of inclusion task force, I had like 5, 6 Latino students that, both from UCO and OCU and OU messaging me saying, hey, can I come shadow you? I'm interested in medicine. But COVID has kind of put the brakes on that. So yes, shadow physicians, doesn't have to be a surgeon, it can be whatever field that you're interested in. And one thing that I think is important is start working in a little bit of research. And what I mean by that is the majority of science departments within different colleges will have different research program, whether it's working in with mice, whether it's behavioral science, whether it is gene expression, running PCRs. And by now, COVID has, people know what PCR is a little bit. PCR is not just for testing; it's like an actual technique that we use for gene amplification in science and in labs. So you start learning those things at an earlier stage, and the more you learn about the scientific process of research and things like that. So those are the things that I think helped me get into medical school, and that they still heavily valued when students are applying into medical specialties, whether it is dental school, PA school, medical school, etc.
So do your research, guys, that you're listening. Go do your research. It looks like Francisco wants to play tennis with you.
Yeah, I'll play tennis. Let's go.
Francisco
Let's
is with.
wait until it's not as hot though, because playing tennis in 90-degree weather, it's terrible.
Yeah, Francisco represents our Puerto Rican Association here in Oklahoma. So there's large.
Oh my God, where can I get some good mofongo here? I'm missing some.
Yeah, Francisco, you're gonna have to let him know. Okay.
I know.
And then Brenda has another comment. Again, muchas gracias, Doctor Claros Sorto, por todo
Sí, yo pensé que íbamos a hablar español, pero Miriam me puso a hablar inglés aquí.
Sí,
pero Brenda nos mandó un mensaje en español aquí.
Sí, un poquito de los dos. Sí, aquí hablamos de todo. But just to kind of wrap things up, you mentioned COVID, and I know you've shared a lot of valuable information, but I wanted you to tell us a little about what are you doing to manage your own wellness through this whole COVID situation?
Well, the usual things I was doing even outside of COVID was just, gym. I like running. I was actually training for the marathon this year. It was going to be the first. I ran the half before. I've ran a couple half marathons. I've just never run the full. And I was training to run the full for the first time, and I was doing well. And then, of course, COVID happened, and then it was kind of like an excuse, like, well, I don't have to stop running. Well, not stop running, but stop running long distances. So I've continued to run, just not as much, especially with 100-degree weather. I tried to run like 4 miles the other day, and like mile 4, I was calling my girlfriend to come up pick me up because I couldn't run back the 4 miles back. I was like, please don't get me, I'm dying. Yeah, I underestimated the heat for sure. but I actually enjoy going to the gym as well. But because of COVID, I haven't been able to go. Not so much, I don't want to get it, but I don't want to give it to my patients. I work with a very vulnerable patient populations. My patients are getting chemotherapy, and I know that even though there are physicians my age that have died from it, I know that the probability of me getting significant issues from it are very, very, very small. I will just hate myself if I give it to one of my patients. Okay, so as a physician, we do carry that responsibility, and that's why I've been kind of secluding myself. Like, I haven't seen many of my friends that we have a lot of friends in common, and Carmina and such. I don't want to name all of them here, but I haven't been doing all the things I would like to do. But I think the two that I would say is probably running and photography. I continue to take pictures here and there. I had a friend actually recently that gave me a film camera, so I'm shooting film again now. So it's gonna be fun.
Well, you'll have to share some of those pictures with us then, now that we know that you're going to be out doing some photography. But I just want to highlight something that you just said, that, as we're all going through this whole situation together, you care so much about your patients that you're taking the responsibility to make sure they're protected. And I think that resonates with me and with many people watching, that we do have to take that into consideration when we are with our families, with a lot of people we work with. So,
Well, and one
please.
thing I should mention is, particularly once again, since this is a Latino based group, Latinos, we're multi-generational families in a single home. So to me, what makes it, part of the reason why I'm like, if I get it, because like I mentioned, I don't have any family here, so I can give it to my family, but when it comes to our Latino younger, whether they are kids or teenagers or ourselves adults, it's like we might have grandma, abuelita lives with us, and you have to be extra careful because you definitely don't want to give it to them because they're the patient, population that are not gonna do as well.
Absolutely. I couldn't agree more. So again, stay safe, guys. And again, Francisco is going to get you some mofongo and pernil.
Oh yeah.
He'll reach out to you. Um, but again, we are about out of time. But again, we want to thank you for taking the time to share your story and your experience with us. I just appreciate everything that you've done and that you will do in our community to help patients. So thank you for taking the time. We really appreciate you being with us today. So any last words?
No, hi to my girlfriend Anna. I know she's watching.
Hola, Ana. She's Venezolana, right?
Yeah, Venezolana.
Saludos.
Yeah.
Again, everyone, thank you for watching. Please stay safe out there. And if you have any questions, we'll post all the links and videos that we mentioned today so that you can get more information. And if you need to, reach out to our good friend Juan Carlos with any questions. So,
Oh, one last thing, I guess, for breast mammograms, breasthealthnetwork.com. I didn't tell you ahead of time, so you can put it in the bottom right there.
okay,
But breasthealthnetwork.com, that is kind of like the OU. We have technically five, but four different breast imaging sites. And there's going to be information about how to get your mammograms there. So get your mammograms.
yes, get your mammograms, ladies, and we will share these links with you. But again, thank you all. Have a great day.
You're welcome. Thank you. Bye.